Okay, so you've had a look in the roof of the mouth, you've checked the uvula, and there is either a deviation of it to the left or to the right, or nothing's happening. It's lock solid and it's not moving at all. That generally means the head is not sitting properly on the top of the neck. Now there's a very simple self-help exercise that we can do, which was shared to the world by an amazing guy called Stanley Rosenberg. He wrote a book, Accessing the Healing Power of the Vagus Nerve. I highly recommend this. It's a very simple read, and there's a wealth of information written in layman's language that anyone can understand. So if you get 5 minutes, order the book. It's a really great read and will explain a lot about the autonomic nervous system, people with ADHD, autistic spectrum, post-traumatic stress. There's a wealth of information there. But the test that Stanley very kindly shared with us, and Dagmar's going to demonstrate, is what you ask the person to do. And it's very important that we do this either sitting or lying down, because what it does, it changes the signal to the heart and the lungs, and there can be an instant change in blood pressure. So we don't want to do it standing up because we can feel a little bit lightheaded and there is a danger that somebody could collapse. So always make sure they're either sitting or lying, okay? And all we do, we get the hands and we place them behind the head as if we're going to watch TV. We're just supporting the back of the head. So we're not on the neck, we're just on the base of the skull. And what we're going to do is keep looking forward, okay? This is very important. All we're going to do is very gently allow the eyes to roll to the right, okay? But the head stays looking forward. The mistake that people tend to make is they try and look too far and the head follows, okay? So focus on just taking your eyes as far as you can until you feel that there's a pull on the eyes, but the head, very importantly, stays in the middle. So we keep looking to the right, keep looking to the right, and generally, after 30 to 60 seconds, one of two things will happen. Either you'll feel the subconscious need to swallow, the gag reflex, or that person will take a deep sigh, okay? As soon as that happens, we come to the center for a few seconds, and then we repeat on the left. And exactly the same. After 30 to 60 seconds, you will generally get the release of the vagus nerve, which is the sigh or the swallow. So what the test is doing, it's basically using your eyes as a lever to relax the 8 muscles that hold the head onto the top of the neck. So when we get the release, the muscles have relaxed, the head very subtly repositions on the top of the neck, and it takes pressure off our friend the vagus nerve. Thank you very much. So it's as easy as that. Once you've done the test, get the torch out again, reassess, and if it's improved, if the deviation that you saw has come back towards the center, there's usually a 50 to 100% improvement just in the time it takes to do this test. It's very, very powerful. So if things have improved significantly, then you're instantly ready for the rehabilitation phase. If you're not, if it stays the same, and it's usually when the uvula is just lock solid, it doesn't want to move, that means that it's a bit more mechanical in nature, and you're going to need some hands-on treatment to release that vagus nerve. And that's probably why the body was stuck in that state, because it was so tight, either on the left or the right. So you'll need a bit of hands-in intervention, which the person who sent you this, the link to the app, will be able to guide you to an appropriate therapist. Okay, so thanks for looking, thanks for doing the test, and share this with as many people as you can. Take care.